Wow.
I figured that it would be really good to speak about Lyme disease today because this is the time when those ticks are out, and this is when individuals start to get infected with Lyme disease. So, we spoke about allergies the past few times together because it was relevant to the here and now, and we'll speak about Lyme disease today. So
Hmm.
I'm sure many of us have heard about Lyme disease, and it's caused by a tick bite. Now, after the tick bite, it takes about 3 days to a month for someone to develop symptoms of this infection. The tick transfers a sphericete, or we'll just call it a bacteria so it can be easier to understand. It transfers a bacteria, and that infection causes real discomfort, fatigue, headaches, joint pains, flu-like symptoms, fever. And I've seen cases of acute Lyme where somebody just got infected and they look terrible. They look um, like they have the worst case of the flu possible. But thankfully, most people get better within a few weeks, or within a few weeks, most people get better, but they can be uncomfortable for quite some time. This is the culprit here. This is a tick, and they're quite small. You know, you can't see them very well. They are visible to the naked eye. You can see them, but you can miss them easily. They're about 1/10 of an inch, so they're real tiny. You know, Lyme disease was first diagnosed or described in Connecticut in old Lyme, where there were a bunch of children who were presenting with joint symptoms and arthritis. And as it was looked into further, they realized it was an infection that was leading to this arthritis. So it's a disease that was discovered here in Connecticut. These ticks travel on deer, and that's their traveling agent. They live on deer, they travel on deer, then they drop off onto into the woods and on grass and on shrubby areas, and then transfer themselves to us, where they cause problems in humans. Now, this slide is busy. Don't get overwhelmed. I'm going to break it down for you very simply. There are three different stages of Lyme disease. Most people are in the first stage. That's called early Lyme. They get bitten by a tick, and within the first few days to a month, they can get a rash, a bullseye rash, and I'll show you what that looks like so that you know what to look for. And then they get symptoms of the fatigue I mentioned earlier. They feel just horrible, like they have a bad case of the flu. My husband came down with Lyme disease on more than one occasion because he's always outside. He's always in the woods. And for whenever he gets the Lyme disease, he's like out, for a few days. It's such a horrible infection. But thank God he's always bounced back. Um, so that's early Lyme. And then there's something called disseminated Lyme. So it's causing more of a problem than just what we call, fever and fatigue and joint pain. It's actually attacking organs. So you can get heart inflammation, you can get nerve damage where your nerves don't work so well, or you get really weird numbness and tingling in certain parts of your body. It can cause joint swelling and pain, and very swollen lymph nodes can happen. You can get swollen lymph nodes. And then there's a late stage of it where I see those people, they have chronic Lyme arthritis, where their joints are like swollen, big swollen knee, swollen wrists. Joints are very swollen. I have to put a needle in and drain the fluid out. It's so swollen. And that's the third stage. And they can also get more involvement of nerves. So you see, Lyme disease is not a petty matter. It's really serious, and we need to be sure to be well educated on how to avoid it, how to treat it, and how to prevent chronic long-term issues. Here is a rash. In layman's terms, we call this a bullseye rash. Now look at it very well, and notice that the inside part is clear. So it's there's a red ring on the outside, and the inside part is clear. And here you see where the tick actually bit. This is a bullseye rash, or erythema migrans. That's the term we use in medicine. Now, what are some practical tips that we can use to try to protect ourselves from Lyme disease? Well, the first thing is avoid tick bites. So some folks use this to say, oh, well, that's why I don't go outside, or that's why I don't send my kids outside. But that's not the best way. That's not the best way to go about it. Because really, we need to spend time outside. We've discussed that before, Pastor. We need to get fresh air. We need sunshine. And the best exercise is obtained outside in God's nature. So when I say avoid tick bites, there are things that we can do while we're outside to really decrease our risk of being bitten. One is dress for success. I love this term because it's important to know how to dress to be healthy and well. When you're going outside to a wooded area, or just to garden, or within your own lawn, make sure that you cover well. So wear long sleeves. When you're wearing pants, tuck them into your socks so the tick won't get in and under your skin. If you're wearing tights, tuck the tights into your socks. And that's one way to decrease the tick from getting exposure to your skin. Tuck your shirt inside your pants so they don't get under your shirt and at your waistline and on your belly area to bite you. So dress for success. Pay attention to how you're putting on your clothes. You can use tick repellent. So these are ways to try to avoid being bitten, right? So you dress for success, you use tick repellent, and tick repellent with DEET in there. The DEET repels the ticks, and that's a good one to use. But of course, this is a chemical that it can lead to possibly long-term effects. So we don't want to have high DEET in our tick repellent. A modest amount is fine, and I wouldn't overuse it. If you are one that would prefer something more natural, like myself, I try to use less toxins if possible. You can use certain scents that ticks do not like. Ticks do not like the smell of lavender, peppermint, lemongrass. They hate the smell of garlic, and citronella oil they don't like. And that's why you'll also find that some of these tick repellents, they have some of these oils in them, because they're using that mechanism to help repel the tick as well. So you can combine some of these essential oils and mix them in some simple olive oil or other oil carrier, and spray it on your skin, wipe it on your skin, and that can help too. Also, if you find a tick on your body, you need to remove it properly. Now, this is a common occurrence in my house. I remove ticks almost every single day. And that frightens some moms because they're like, what? But the reality is my children are always playing outside. I live in a wooded area, so they always come back to the house with ticks. So I need to be prepared. I have tweezers in the house, and every home in Lyme area or Lyme endemic area like Connecticut, New York, Rhode Island, all of these northeastern states, every home should have tweezers. A tweezer in the house and a tweezer in the car or in your backpack when you're on the road. Especially when you're going camping, put that tweezer in your emergency kit, because somebody's going to get a tick embedded in their body. So you see the tick, and you need to place the tweezer as close to the skin as possible. Don't just put it by the body up here and squish all the contents of the tick from the body into your body or into your kid's body. No, put the tick all the way by its head here and be as close as you can to the skin. Grab a firm hold of it and kind of gently rock it out. It's scary at first, I must admit. My first tick removal, I was, woo, you don't learn these things in medical school. This is just practical living. But when I had to remove the first tick from one of my children, I had to really grab that tick well, rock it out, and once they haven't been embedded for a long time, they come out fairly easily. If you want to add some isopropyl alcohol, or if you want to add some oil to help it start out easier, that's fine. But you just need to get a firm grasp and just rock it out gently. And once you get the tick out, destroy it, kill it. It's dangerous. Don't put it back outside. I just get a knife and I annihilate it. so that's something that you need to have in your house. A tweezer, must always have a tweezer. Every night, tick check your children, tick check yourself. This is a way to prevent getting infected, because generally in medicine we say if the tick has been on you for less than 24 hours, you're usually okay, because once they get on your skin and they start to bite, they don't feed immediately. They take a few hours, I don't know why, but they take a few hours before they start to feed. And once they start to feed and suck your blood, they stay on for about 3 days. So if you check every single night and you know that last night you didn't have a tick on you, but tonight you have one, you've probably caught it within that 24-hour span. Once you remove it, you're usually good to go. But if it's on your body for a full 2 days, 3 days, the risk of it passing on its bacteria to you becomes higher and higher. And when that happens, you must call your provider. You must go in for evaluation. And I highly recommend that you take treatment, because the individuals who have problems with Lyme disease are usually the ones who don't get treated early. The earlier you get treated, the better off you are. Okay, so it's important to remove the tick well. Tick check every night. Make it a ritual in your house between April and September. You know, the spring, summer, and fall, when the tick are out and you are out, check and remove the ticks every day. Here's a picture to show you. They're so small, they're so tiny. You have to really search to find them. And this is the baby stage here. Then they become adults and get bigger. And here is a picture of one attached. I've seen this over and over again in my own house. The head is dug into the skin and it's feeding. And here's the rash on this side that you can see a few days after a tick bite.
So, Doc, you used the term there, Lyme endemic area. What does that mean, by the way?
Okay, thank you for asking that question. I try not to use big terms, because my aim is to make sure that my communication is easily understood by even a second grader. So I really try to make sure that I break it down. So thank you for picking that up. An area that's endemic is an area where there's a high rate of disease. So those areas are the northern states of America, where we have a high amount of deer, and the tick love to travel on the deer. That's their mode of transportation. And so in areas that you have lots of deer, white-tailed deer, you have lots of tick. And those are the areas. So Connecticut is certainly one, and areas here on this northeast section, New York, definitely, and Rhode Island, all those parts in the northeast. Lyme is also found in other parts of the US, but it's just very prevalent in the northeast region here.
Yeah, I see. And now, are there any particular areas that if you walk or camp that you're exposed to ticks more so than others? I mean, I love to be outdoor. I've never had a tick. At least I've never had an encounter with one that I know of, right?
Oh,
A
wow.
recorded encounter. But I spent hours on hours outside. So now you got me
Wow.
thinking, maybe I need to think about where I'm going here.
You know what? I'm glad to hear that you spend hours and hours outside. That is ideal. That is the way that we are supposed to live. We should be outside in the sunshine. And, if you are in an area where you see deer, do you see deer in your area?
Well, unfortunately, I always see deer in my neighborhood, but yeah, luckily they haven't brought any tick by, I
That's
guess. Yeah,
amazing.
but
So,
it's because even in my yard, where we live most of the time in Manchester before moving here, yeah, waking up in the morning, there were deers. I had, walking through my yard, we had wooded areas, and the deer was always going back and forth. it was a daily occurrence.
Yeah, well, you know
But
what?
yet,
If you had deer, you had tick, but somehow your body is emitting wonderful aroma that the tick does not like. So maybe,
okay.
a scents that we like, lavender. Do you use products with lots of
Uh-huh.
lavender or peppermint or those things? Maybe you're repelling
Well,
them with a nice aroma.
not maybe garlic is my
Garlic,
heavy use. I
possibly.
don't know, but the other stuff, no.
Yeah, garlic is a
you
smell
know.
they don't like. But you have been very fortunate. But I'm sure that there were tick in your garden, in your neighborhood, in your wooded area,
Mm.
um, and you were quite fortunate that you did not ever experience a tick bite. And you know what? Tick bites are painless. So you would never know that you got a
Uh-huh.
bite unless you search for it. And you may be one of those individuals who never got Lyme, because not everybody who gets a tick bite gets Lyme. It's a very important point. So you don't have to be thinking, oh my
Hmm.
goodness, I got a bite, I'm definitely going to get Lyme. No. I would say, I don't know the exact numbers, but definitely at least 10% of people who get tick bites, if not more, it could be more, but you don't have to get Lyme. It could even be up to 40%. Do not get Lyme disease. Okay, so you may have gotten bitten
Hmm.
and just you didn't get the infection, you didn't get the disease. So that's wonderful.
But I'm assuming it would at least leave the red mark of some sort. A mark that said I
Yes.
was here.
Yes,
Yeah.
70% of people do get that rash. 30% don't. And then sometimes you don't even notice it. So that's why I recommend that you look for it when you're in an area that you know they're tick. Look for it. Check your body every night if you're outside a lot. And even if you aren't
Hmm.
outside a lot, if somebody else is outside a lot, they can bring the ticks in. The ticks travel on clothes. If you have pets who go outside and
I
come back
see.
in, they bring the tick in. I've often seen tick just walking on my dining table. They just walk wherever they choose. They love to hitch a ride. So it's important to just be aware of their presence because
Mm.
they are around. If the tick, oh, we were saying, so
I see.
if you catch it less than 24 hours, you're usually in a safe zone. But if you can't tell that it's been less than 24 hours, or if the little fellow is engorged, when they are filled with blood, they get massive, and you can see
Mm.
that you can tell that it's full. If it's full with blood, call your doctor. Go in right away. There's a blood test that can be done to check for Lyme disease. And so you want to have this blood test done. Also, there are medication that are really helpful, antibiotics that are very helpful to treat Lyme. And the side effect profile is not that great, and the benefits outweigh the risks. You want to treat Lyme disease and not get chronic Lyme. And also switch to a really nourishing diet. So if you're not yet on a whole food plant-based diet and you've gotten bitten by a tick and you may have Lyme disease, make that switch. Get off processed foods, get off sugars. All these things decrease the immune system. A plant-based diet, a whole food plant-based diet, helps to boost your immune system, helps to optimize your immune system so you can deal with this infection from this tick and increase your juicing. You want to almost switch to a super hyper nourishing diet. So start juicing more carrots, tomatoes, apples, beets. You do more juicing when you have an issue with Lyme disease. It just gives you an extra fight for this bacteria. So I want to just go over how to do a proper tick check, because in this case, prevention is far better than cure. When you're doing your tick check on your children and on yourself, always check these areas because ticks like these areas the most. The hairline. Check right at the hairline all around your head. I always start there first on my children. Then come down behind the ears. They love to hide behind the ears. Check the neck. Then look under the armpits. They hide there very easily. Then you go down to the waistline. Check that area very closely, and then look behind the knees. They love those areas for some reason. That may be because they can hide there easier. But check those areas when you're doing your full body tick check. Okay, so that's that's our view of Lyme disease. I really pray that if you come in contact with a tick, don't be afraid. You're educated now. You know how to handle it. Don't be afraid. Remove that tick. Change your diet. Do what you have to. Still go outside. Send your kids outside. Enjoy the nature, but just approach the tick with more education. And now you're armed to fight Lyme disease.
I'm just curious, Doc. You said that the ticks they travel on deers. What about, I know, does tick travels on dog, or is it the same tick that
Yeah,
does travel
no,
on dog?
they're different ticks actually. So typical dog ticks, they're bigger and they do not carry the bacteria that causes Lyme disease. But this sneaky guy here, his name is Exodes. It's a special kind of tick.
Hmm.
He loves to travel on white-tailed deer, but if your animals are outside roaming, they can get stuck on their hair and end up inside the home. But the dog and cat are not typical carriers of this tick, but they can certainly hitch a free ride every now and again.
I see. Now, I noticed that as you were talking about building the immune system, in the past you gave us this immune booster builder
Hmm.
that had the garlic and, certain other things. This
Yeah.
time I noticed you said increase your juicing, but you said tomatoes and carrots. And what are the differences? Are different juices apropos for different situation? Because you were addressing the issue of building your immune system.
Hmm.
But
Hmm.
but you threw this in now, yes.
I love that question. I really do. So we will have to have a whole separate talk on juicing, because the way I look at juicing, it's you use juicing when you are treating a big bad disease and you want to give it a hard hit. You go into the hospital and I diagnose you with pneumonia, and it's just a little tiny thing. I may give you some oral pills and say go home. If it's a real strong pneumonia that needs a big IV dose of antibiotics, I'll put an IV in your vein and give you the medicine through your veins. That's what juicing is like. You're really gathering your foods and preparing a super nourishing IV boost of antioxidants to fight free radicals, fight infections, and optimize your immune system. So I mentioned juicing here because Lyme disease is no plain matter, and you want to almost go to a IV state of hypernourishing food. So you juice to help increase the concentration of vitamins and antioxidants that you get from foods. And so that's why you add juicing when you're dealing with certain really big diseases. Um, the garlic works well for this too. Some chronic Lyme individuals need garlic every day in big amounts to help their immune system. But I mentioned juicing here because it's like a super nourishing IV jolt for this kind of disease.
Now, usually when I hear about juicing, people talk about green juicing.
Hmm.
But the stuff that you mentioned aren't green. I don't know what's the difference between green juicing and juicing tomatoes and carrots,
Yeah.
that kind of stuff.
You know what, Pastor? I will prepare a whole special segment just for you on juicing, because there's so much to discuss about there's a whole science to it. It's not hard, but it needs to be properly understood. The
Mhm.
different foods, the green foods, the colored foods, they have different ratios of vitamins. Some are, for example, we all know that carrots are high in vitamin A, and
Mhm.
so when you want, and that's a powerful antioxidant. So it's a common feature in many juicing recipes, and it's also very palatable. You can take it easily. It's sweet. It tastes great. So it helps in a juicing protocol. But for example, the greens, those are the superfoods because they are so high in particular phytochemicals. So I really have to have a special, I'll put that on my curriculum of things I'm going to discuss with you. Juicing, maybe a whole week on juicing. But it's very useful to fight disease, very useful.
Awesome. Well, thank you very much. Appreciate you spending the time with us talking about Lyme disease. I don't know if there's anything else you want to say about the disease itself and its treatment or its prevention
You know,
that you haven't already said.
sure. I try to synthesize the most important points in this presentation this morning, but the most important thing is to try to, one, avoid getting bit, and if you get bit, catch it early.
Mm.
Earlier the better. Prevention is better than cure. Find the tick early. Tick check every night, and once you find that culprit, take it out and kill it.
As we've been talking about COVID-19, from what I get, I guess it attacks primarily the lungs. That seemed to be its primary attack area. In the case of Lyme disease, what areas am I expecting that this is compromising?
Yeah, yeah. So initially, it's usually just a what you call a all over flu-like response. So you just feel horrible for a few days, fever, headache, nothing focused. But if it progresses to the second stage, then it can affect the heart. It can affect every organ actually: the heart, the brain, the eyes, the nerves, the kidneys, the liver. It can be very virulent. So that's why it's important for us to be well educated about it, because we are here in Connecticut and this is Lyme country.
Well, Doc, thank you so much for spending your time with us. We're going to say a word for our closeout, and then we look forward to seeing you again on Monday.
Yes.
All right, Eternal Father, thank you so much for the time we spent together. Thank you for Dr. Yoingo, Lord, and her willingness to come and to bless us with her knowledge. I pray that you go with us now. Remember, all our viewers and our listeners online, keep us all faithful to you. And when you come, save us, we ask. In Jesus' name, amen.
Amen. All right. On
Doc, have a
Monday,
great day. Yeah, go ahead.
yes, on Monday, I plan to talk about the best diet on the planet.
Oh, wow. Want to hear that? See you
All
then.
right. Take care. Goodbye.